Hadn't moved yours out either? Anybody else have to go to rules? Okay. Well, all right. Let's see, I think that I'm going to call Senate Bill 31. Representative Hatchett. I think our posture is that it is on the table, so we need a motion to move it off the table. Representative Peak.
Madam Chair, I make a motion that we take SB 31 off the table for consideration.
Okay, do I hear a second? Second. All right, everybody in favor of taking it off the table, say aye. Aye. Anyone opposed, no? Okay, the ayes have it, it's off the table. All right, Representative Hatchett. Yes, or you can sit right where you are. It's whatever you want to do.
Make sure I've got the right.
Hey, guys. Okay, thank you, all right,
Okay.
Representative Hatchett.
Thank you, Madam Chair and members of the committee. I bring to you a substitute to SB 31. I believe the LC number is 337454S. Is that correct?
That's correct. Does everybody
Okay.
have LC 337454S?
What this change is, as far as the CTCA language in the previous bill that we heard last week, this changes the penalty and the requirement of indigent care for CTCA. The bill last week was a requirement of 5% indigent care. This language increases the requirement to 6% indigent care. And it changes the penalty to read that it's 2% of adjusted gross revenue or the difference between the 2% adjusted gross revenue, or no, between the 6% indigent care. I'm sorry, I'm getting confused myself. Between this, what would be required from the 6% indigent care less what they actually did incur. So the 2% figure for 2016 would have been $18 million. What if this bill were to pass? What if it had been in existence in 2016? They would have been fined 13.3 some odd million dollars for not reaching 6% indigent care. I think they reached around 4.5%. The bill also includes the language from the bill we heard Thursday that was the, I believe it was SB 81, the substitute SB 81 that involved our great hospital in Atlanta, CHOA, that allowed them to co-locate beds in existing hospitals. There are some amendments. I'm sure that we're going to have a little testimony, I believe. I don't know if we are or not, but you will probably hear that the CHOA organization does not want the bill that they had Thursday, and I can elaborate at a time later that if I'm allowed to. And that's kind of my presentation now. And if you want me to discuss one of the amendments or one of the amendments that I added, I can do that, Madam Chair, if you want me to do that.
Does everybody have an amendment? I think there's still one being printed. Okay, go ahead.
Okay, I have one amendment. It's Amendment 331774 that would allow, well, it removes the capital expenditure requirement for facilities that have a CON. So any improvement in the actual facility, if you have a CON, that capital expenditure requirement would go away. Right now, I believe I think it actually right now is at $2.8 million. You have to, if it's over that, you have to apply through CON to have that done, even if it's like a parking lot. So
questions from the committee, and we've discussed the children's one, so, and we discussed the basic bill, so let's keep the questions to if it's something different, since I have to go to rules, so.
Can I say one thing that is different, I'm sorry, with the CTCA penalty portion? If they do owe a penalty, the money would go to the Indigent Care Trust Fund, and we've created another area or way for that money to go through the Indigent Care Trust Fund. It would actually go to the State Office of Rural Health, the Department of Community Health, for their rural stabilization, hospital stabilization program. That's in the bill. It's line 212.
Okay, Representative Peake,
I'm waiting.
wait, Suzie, start. Pardon? Okay, we don't have any questions from the committee? Okay. Okay, Representative Newton first, I'll get you.
Thank you, Madam Chair. Chairman, right here. Quick question on the
Hang on a minute.
amendment. Is that in essence that if the only reason they needed a certificate of need was because of the amount of the expenditure, that would no longer be a reason enough just for that to need a certificate of need, just because the parking deck was $3 million
Correct.
and over?
Correct, that's my understanding.
Okay.
Or if you wanted to add onto your emergency room, then that would
Is it working?
be exempt.
We're,
Well, I mean, you could do it less than 2.8, but.
that's right.
It's working.
that's another.
All right. Thank you. Thank you. I think that was my question.
Okay, Representative Henson.
Okay, thank you. I know they're putting in the Children's Hospital, and we passed that bill out, Senate Bill 81, the other day. Now, if it's put in here, what happens to Senate Bill 81? No, I'm talking about the bill about
It
CHOA.
didn't, it's just in limbo.
But we passed it, didn't we?
Yes.
Yes.
The other day, the last meeting?
Yes,
Yes.
but it's not uncommon for two bills to go.
I understand, but, you know, I was very supportive of that bill
Right.
being added. And is that supposed to make us feel more favorable towards this bill by putting it in?
That is up to each individual legislator to make up your mind. So, okay. Is that, no questions? All right. Okay. All right, so we've got a motion. Do I have, you ready for the motion? I have a motion. Do pass. And a second? Did I hear a second? What? No, the bill, and then I'm gonna go to amendments. So, we're gonna move the bill. Okay, and a motion second. Okay, now we're gonna take up amendments. Who's that? Representative Mitchell?
I
You're
just
coming
like
in
to-
late. Okay,
yes,
go ahead.
I just wanted to hear what the CHOA's position was on the amendment. Will they be getting an opportunity to speak?
The cancer treatment centers?
CHOA, yes.
Okay. Do we have somebody from CHOA? Or you want me to tell them? You're probably nicer.
Thank you, Madam Chair. David Tatum from CHOA. We are in an interesting position. We very much appreciate the vote that this committee gave us last week on our bill to co-locate beds in adult hospitals. Upon further consideration and a great deal of debate over the weekend, our leadership made a determination that we would request that Senate Bill 81 be withdrawn. We have decided to participate in the CON discussions that are to occur after session, both in the House and the Senate, with an eye toward long-term approval of what we want to do. And that is our position.
But of course, as you know, David, that just because you want something doesn't mean you get it, and the legislature can decide what we want to do.
It was our request that it be withdrawn, and I understand, Madam Chair.
And I understand that there were a lot of calls that went out to your CEO until she felt compelled to make that, to tell you to withdraw. So, thank you. And you didn't say it, I said it, so if it goes back to her, you can say, and anybody else in this room, that they want to go back and complain to the CEO of CHOA, I'm the one who said all this, and she can call me if she's not happy with it. Thank you. And I think that Representative Hatchett has things to say on that also. Okay, so we're not, okay, let's move. Okay, we'll do them one at a time. Okay. Representative Hatchett, let's do and vote on your two more amendments. Let's vote on your amendment.
Amendment
Briefly explain it again.
Amendment 331774, it removes the capital expenditure requirement for facilities that have a CON. That's what it does.
Okay, that's all facilities, hospitals, everybody.
Yes, any CON entity in that chapter.
Okay. All right, do I have a motion? Got a motion and a second? Any discussion? All right, everybody in the favor of the Hatchett Amendment, say aye.
Aye.
Anyone opposed, no? No. Okay. All right, everyone in favor of the Hatchett Amendment, raise your hand. Okay.
Did you get me? Because I do get the vote.
Okay. Everybody opposed? Okay, the amendment fails. It's 13 to 14. All right. Okay, we have another amendment. I believe that is one that Representative Lott brought. Representative Lott? No? You want to do the one that's, okay. Yes, we can take that, okay. Representative Newton, tell us the LC on yours.
Thank you, Madam Chair. It's AM 331778, amendment to SB 31. Just real quickly, a good bit of the argument in favor of SB 31 with both the CHOA portion and CTCA is for patients to have the choice in where they get care, and that of course means you got to have somebody willing to build and to expand and to provide that. Two areas we've come across repeatedly in this committee and across the House have been that related that almost everybody agrees on is that emergency care that's closer to you or your family member is a good idea and a helpful thing. The other thing we've seen with the public health crisis with opioids and mental health is that there are not enough inpatient locations for patients to receive care. What my amendment does, in addition to allowing both the children's care to expand, patients' cancer care choices to expand, it also allows choices by exempting freestanding emergency departments and a hospital that provides inpatient care only for psychiatric or mental health services. So that wouldn't be a new hospital doing surgery or doing OB, but only if it's a mental health and psychiatric. So it's a very gradual change on CON and a very small one, and an important part of it also is it excludes counties below 100,000. So counties that are in rural areas with hospitals that are at risk or very or on tentative ground when it comes to their finances, it continues to allow CON to protect those areas. But in the areas with an abundance of providers trying to provide the best care, for example, rather than expanding an emergency department to double its size in a downtown location, you could keep it that size and possibly add a couple of freestanding emergency departments that would be closer to patients where they need them. And in addition, I can tell you as an emergency physician, patients waiting for inpatient care in behavioral health and psychiatry is really not something I think there's much disagreement with. So that's why I appreciate your consideration of that amendment as a very, very small change in certificate of need, but at the same time recognizing that patient choice and improvements in care that are almost universal would be advantageous to Georgians.
Questions for the author? Representative Hawkins.
Thank you, Madam Chairman. While I don't disagree with my colleague and the reason you're doing this, I do find that every time we bring the CON into question, it seems to be bits and parts, and I would much more favor a review of the CON at a later date and then include this rather than trying to do this at this time.
Well, considering the fact that we all come back next year, I will be glad to see and entertain us discussing a bill, should this not pass, but what we have on the table is this right now. Yes, ma'am. Okay, Representative Barr.
Dr. Newton, I
If you write it.
respect your opinion
You write it.
greatly, and would you help me understand a little bit better your amendment in that it talks about the rural areas. Can you clarify a little bit of what you're talking about here for me? Once again, I apologize. I'm a slow learner.
No,
This is
I
the
apo-
first I'm seeing it.
I appreciate you being gracious with me. What it does say that in counties with a population of under 100,000, it would be status quo, everything the way it is regarding these two
Yeah.
additions. In larger counties than that are able to, it would open the option up for providers in those areas to offer these couple of new services on inpatient psychiatric care or a freestanding emergency department. It does keep the same language that I think was well thought out with SB 31, with the requirement to make a contribution to the Indigent Care Trust Fund as part of this, and also to provide the 4% charity care. So that adds up to the same 6%, which seemed to be it's double what the normal CON requirement has. So to earn this exemption, that's what would have to happen.
Very good. Thank you.
Thank you. At this point, I think I want to ask a question. If this was to pass, what does happen with CTCA? Are they still under the 6535? Is it totally removed? Are they under CON? Where are they?
Representative Hatchett.
They would be under CON. The 6535 would be removed. They would be able to apply under CON just like any other hospital to add additional beds or to add any other, thing that you have to go through CON for. They would still apply for that. That would have
Just
to happen.
to follow up further. They came in here, they presented something. They're a different hospital than our other hospitals. And I think CON is major, and I think it is at a time that we really need to take a look at it. And I think it needs to be studied between CTCA and between the Hospital Association and others that might be affected. Away from the legislature, away from all of us with mediators, to make them stay at the table and work something out as we go forward. I don't want to hear what happened in the past. I want to know.
Neither do I.
I know.
Thank you.
I mean, because it doesn't matter. I can't step backwards
Come
at
to your
all.
point,
And-
Representative Henson.
But I want to go forward, and I want us to have something that's good and solid, and I feel we're piecemealing at this point, and also coming together at a very, very late date in session, which we always do, but this is major.
Okay, thank you. Representative Beverly.
Thank you, Madam Chair. I'd like to make a motion to table AM 331778 at the
You're
appropriate
not
time.
recognized for that at this situation, this moment. Representative Jaspers.
Thank you, Madam Chairman. To my seatmate, Dr. Newton. On line 3, you describe a freestanding emergency department. I guess for the committee, could you describe what that is? Or is it there may be descriptions somewhere else in 16 that I'm not aware of?
It's simply an emergency department, just like we have now, but not connected directly to a hospital. It's not far off the micro hospital description that we did, although that would have, I think that one added 2 to 7 beds. But it's the same. The code does define emergency departments.
Representative Jaspers, did you not go with us to Blue Ridge or up in the Blue Ridge area where we went to
Madam
that
Chairman, I
really
have
nice
a
one?
further question. So what about outpatient therapy? I mean, outpatient surgery, I guess that's what I'm looking at.
There's nothing in my amendment that addresses expanding or changing anything related to outpatient surgery.
Okay, thank you.
Representative
Thank you.
Jaspers, I asked you a question. I was trying to tell you, did you not go up with us in the rural
Fannin.
to, up in the Blue Ridge area where that we went to a freestanding emergency room, just so
It's
you
in-
know where it was?
It's an LJ, ma'am.
An LJ, and
Yes, ma'am.
it's like attached, but that is one, so you were asking about
Well,
it.
that's a micro hospital.
I don't think so.
Okay.
Somebody from Piedmont, as far as I understood, it was only doing the emergency room work. It's okay.
Describing that as a
Excuse me.
micro hospital. Yes,
And you
ma'am.
describe it as a micro hospital?
Yes, ma'am.
Okay, I'll check it out. All right, we are at the posture of, do I hear a motion on Representative Newton's motion? AM 33-1778. All right. All right, I've got a motion and a second. Any further discussion? Everyone in favor of the motion, raise your hand. Okay. Did you get one over here? Okay, and everyone opposed? Okay, the motion fails. All right, Representative Lott, you have another one?
Yes, ma'am, thank you. I have AM 331776. This is the same amendment that passed the last time we discussed SB 31. The point of this amendment is to put a sunset period on the CTCA's original language of their bill that we've got, well, and now this new LC number language. But what it'll do is it'll put the CTCA requirements of 6535 back on July 1 of 2023. So it sunsets that, the percentages. We're going to relieve those percentages until that date. Otherwise, they have to come back to the General Assembly, or certificate of need has been discussed and dealt with by then.
Questions about the amendment? No questions? Okay. What's the posture? Do I hear a motion? I have a motion. Do I have a second? Okay. Everyone in favor of the motion? Which one, the LC is this? It's AM 331776. Raise your hand. Everyone opposed? Okay. Right, okay, the motion fails. We're back to the bill. Okay, we had a motion to move the bill and a second.
Madam
Say
Chair.
something. All right, so is there any further discussion?
Madam Chair,
Yes.
can I make a statement before you vote?
You have the floor.
Okay.
You want to stay there, or do you want to face?
No, I'll get right here. Committee, I sort of ask you to think about what is our charge on this committee. We've got two hospitals here, one CHOA, who asked to be able to help children across the state in hospitals that already exist with co-locating beds. And we've got another hospital that wants to help more Georgia citizens in their hospital beat cancer. Take everything else out of the picture. And you've got a hospital that we voted on last week that changed its mind because of unforeseen pressure from other hospitals and other sources. They thought they had a great thing. They thought they were doing something super that would help children. And, until we do something to help these hospitals that may see an avenue to change CON so that they can become more profitable or stay alive. We've got to do, I mean, to me, we've got to do something. And you know, you're correct that the rules and regulations for CON have not been formally updated in over 30 years. You know, it's time. But when is that time? We keep pushing it down the road. I've sat in hours of meetings in this room about CON. You know, when is the time correct for us to make a change and sell other hospitals across this state? If you want a change in CON and you want to help your hospital become more profitable or just remain in existence, if there's something that we can do to help you, we're open for business. Let us know. Bring us more until that happens. And that's where I'm coming from on this whole, that's how this bill came about. Because I hate that they're backing down on what they really want to do, and the choice is gone. So that's all I've got to say. Thank you for allowing me to do that.
I'm not going to take any more questions or comments. We are in the posture of voting on the bill. We had one person from the audience who wanted to say something. Ethan, does it relate to this, or you just want to come up and acknowledge your apology to me, which I greatly appreciated? You manned up and did it. Thank you very much for that.
Madam Chair, Ethan James with the Georgia Hospital Association. Always a pleasure to be back before your committee, and absolutely I extend my apologies for some of our interaction the other day during committee. Thank you. Just wanted to restate our opposition to this measure and underscore the fact that Children's Healthcare of Atlanta, one of my members, did withdraw consideration for SB 81, and the fact that it is attached to SB 31 now does not change our position on SB 31. We do stand in opposition to that, as does our entire membership. Happy to answer any questions.
Thank you. Okay. Okay.
Roy, to be clear, it was the underlying bill. I know were some of the amendments that some of my members did support, but I believe those failed. So we still stand in opposition to SB 31.
Okay.
Thank you.
All right. So it's with your membership, there's some on both sides of the issue, just like we have some people on both sides of the commission, the issue on the committee. Okay, we're in the posture for voting. Everyone in the favor of the passage of the substitute to Senate Bill 31, it's LC 337454S. Raise your hand. Okay, everybody opposed? All right, the bill fails. I'm going to put my 2 cents in here. A few years ago, well, we had another bill like this. It was over the dentist and the dental hygienist. And a few years ago, the nursing homes, and a lot of you weren't here, year after year, the nursing homes fought assisted living designation and the establishment of assisted living facilities in our state. You know, the nursing homes liked having patients that had great cognitive skills still and just, couldn't get around quite as well as they did before. And they really wanted to keep those patients. It helped balance out the ones that were even sicker. But times have changed. And I would think that most of us don't want to go to a nursing home, that if we have to have a little help, that our choice would be in assisted living. And we had year after year knockdown, drag out. And finally it came to a year when I sort of had the speech that Matt had and said, you need to go work this out over the summer, we are going to get an assisted living facility because it is what's best for Georgia citizens. Now, let's just get it out clear and open. Privately, several of the hospitals are coming to me and saying that it's time for change and that they know it. And these are the big hospitals in this town that probably called and told you to vote against this bill. Because there are things that they want that will help the hospitals that are being hindered by the fact that there's just this overall no. And I think that probably, if it isn't clear to all of you, I can care less about the hospitals in this situation or the doctors. What I care about is the patients and what's best for patients all over this state. For patient convenience, for patient choice. I mean, Georgians have a right to make decisions for themselves where they go to be treated, what kind of treatments they have. And if it's not the best thing because other hospitals don't believe in it, it's none of the other hospitals' business. Because Georgians have a right to make those decisions. And so it's time for the hospitals to get together and find a way to help yourself some, but also to give a little bit on the other way so that we can help our children. Now, I think it would be great to be in South Georgia when we're in these small hospitals that are not using 20 beds of 100. And people have a choice to take their children to the type of care that's given at CHOA. Or for that matter, WellStar has I think they're starting a unit on pediatrics. But most hospitals don't have it. And most people around this state don't have a choice unless they drive all the way to Atlanta or Augusta to have a children's hospital when their children need to be treated. And I think that's terrible. If CHOA or the hospital in Savannah that does children, or the medical college, which I will always call it the Medical College of Georgia, and they were in favor of that bill, were willing to reach out and put some beds in rural hospitals across this state so that children all over our state have an option of being treated in that kind of a hospital. And what I have to say to the infighting like this and the no is shame on you. That it's all about money and how many hospitals you can buy and whether you're the largest provider or not and keeping the other people out. And I have not heard anything about the patient and what's best for the patient. And personally, I'm tired of it. And you know what happens down here? It was really fairly close votes. And sooner or later, there are going to be enough of us that are going to be pissed off enough, pardon the expression, to where there will be a change. And it may not be the negotiated change you want. So wouldn't it be better over this coming summer to sit down and look at what you can get to help yourself as a hospital and what you might do to give a little on the other areas? And think about what's best for Georgia patients for a change, instead of your bottom line or making sure that you stay the biggest hospital or that nobody comes into your territory. Now, I have a lot of experience, and I like my home hospital, although there might be somebody here that lobbies for me that thinks I don't after this session, but I do. But a couple of years ago, CHOA called me. This is what goes on. CHOA called me and asked me to write a letter that they could get a CON to do CT scans at their new facility up in Cobb going toward Cartersville. And I said, sure. And within 24 hours, less than 24 hours, I get a call from the lobbyist for WellStar in not too nice of tones to me saying, what do you mean giving and writing a letter for CHOA? And needless to say, I wasn't too happy. But I said, let me tell you something. There are plenty of children in homes up in that area and toward Cartersville. There's enough room for a pediatric specialist for WellStar to have it, and there's enough for CHOA. And you know what? I said, I'll write a letter for you too. And guess what? There was enough children in those areas that they both got their CO in approval. So what I want to say to you again is shame on you. I know that there are a lot of smart people in this room that if they will take no out of their vocabulary and sit down at the table and negotiate in good faith, we can come up with something that is better for the citizens in this state. And that's who I care about. And I would suggest strongly that you think about doing it and getting it started. And then I won't hear that we're doing stuff at the last minute and that we're piecemealing it. And it'll just give you something to sit and think about. Because I'm telling you, I'm not the only one. MEC thinks about this, and there are a lot of other people in the legislature that have come to the point where we are, that we want to do what's best for all of our citizens in Georgia, even if they're not a big complex and a big hospital system in the metro area. And that we tell the truth about what's going on, and we don't make up stories, and we look at this in a very realistic, sit down, take it easy, and find ways to give on both issues. Help yourself, hospitals, while you also give something. And I'm really done. I'm not taking any other questions. Thank you. At this point, did I hear somebody, people in the audience do not, run this committee.
Consider reconsideration immediately.
I'm not going to recognize you this. I think we've hassled this out until the point, that I'm sick of it. But it will be back. And if we have to start it at the first of the session and bring it up every time we meet, that might be what we have to do if you can't come to working together. And like I said, there are a whole lot of smart lobbyists in this room. The big barrier just seems to be saying no, 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 like a 2-year-old's. And with that, that's it. We have Representative Mathiak. After that, do you really want to present your House resolution? Yes, go ahead. Right. Because you're leaving.
Thank you, and I'm only saying this because I'm leaving, and my wife would probably kill me if she heard what I'm about to say. But nobody watches this feed anyway, so it doesn't matter. With all due respect, my father was diagnosed with stage 4 kidney cancer last July, and it's just been one train wreck after train wreck. And I've heard about how CTCA people talk about them as if they cause cancer, not treat cancer, and my father-in-law, never had the option to go to CTCA, just because, they're at their limit. But it went so long, the cancer moved from his kidney, wrapped around his spinal cord. I would love for him to have options. Love to. Thank you.
Thank you. Okay, Representative Mathiak, let's wind this up. Thank you, Representative Hatchett. No, just do it from your chair. And just read, it's the number and the LC number.
Okay. I bring to you substitute HR 1592 and the LC numbers 3374446S. And what this does is urge healthcare insurers to provide coverage for less addictive opioids so that it'll be a less addictive, hopefully, treatments, and we would have some alternative treatments for those addictive opioids.
Okay.
And that's it.
Questions for Representative Mathiak? Representative Hanson.
At the proper time, I'd like to make a motion.
Okay, and I just want to say you better be glad you're in this committee and not insurance.
Thank you.
Everybody that the insurance
Yes.
having just survived the insurance commission, maybe, committee, maybe. Okay, any other questions for Representative Mathiak? Okay, make the motion, Representative Henson.
like to move that, well, I'd like to say, ask us to move, let me get this right, Bill here. House Resolution 1592, the substitute 337446S.
Okay, do I have a second? Okay, we have a motion and a second. Any further discussion from the committee? All right, everybody in the favor of the passage of the resolution, say aye.
Aye.
Anyone opposed? No, the ayes have it. And I think I have the hardest working and probably the best committee in the House. I want to thank you for your service. For those that are leaving, Representative Peak, Representative Harden, who else am I missing? Anybody else? We wish you the very best. Thank you for your service, and you will be missed. And to everybody else, have a good summer as best you can with elections going on and one way or the other. And hopefully we will all reconvene in the fall to go at CON again.